I'm Eric Ross. I am the Senior Vice President for Patient Care and System Chief Nursing Officer, and I have the distinguished pleasure of being your MC tonight, and to really be here for what is an incredible celebration of the work that our nurses do, and to shine a light on some just amazing examples of what our folks do each and every day. So it's really hopefully a celebration tonight. I want to welcome a couple of special guests who are with us here this evening as well. So down here in front, we have Cynthia and Edsel Ford, who are here to help represent, I would call it our own Florence Nightingale, Clara Ford. And we really hope that as you hear some of the stories tonight of the nursing world here at Henry Ford Health, it makes you all proud to be part of this family as well. I also want to recognize a few other special guests that we have here with us. So we have our CEO, Wright Lasseter, who is going to be joining us and speaking a little bit this evening. I have Denise Brooks-Williams, who's our North Market CEO. Emily Moorhead, who is our interim president at our Jackson Hospital. I got a whole bunch of CNOs over here. You'll get to see and listen to them in just a little bit. And then Barbara Rossman, who is our president of our present CEO of our Macomb Hospital, and also our former System Chief Nursing Officer. So we've got a lot of really remarkable talent that's here gathered in the room to celebrate all of our awardees. This is really a remarkable recognition, and I stand here very privileged to represent our nursing leadership and to honor 6 of our Henry Ford nurses this year. The Clara Ford Award for Nursing Excellence was established 11 years ago to honor Henry Ford registered nurses for their dedication to our patients, the community, and the health system. The award categories that we're going to talk about tonight align with the system's vision. We will be the trusted partner in health, leading the nation in superior care and value. The vision statement itself begins by articulating what has been revealed time and time again through consumer research. People want to trust the organization as their chosen healthcare partner. As we know, nurses for over 20 years have been voted the most trusted profession, not just in healthcare, but in all industries. And as a trusted partner, the care and experience that we provide to each patient and their family. Our vision is clearly aligned with the nursing core values and the vision of Henry and Clara Ford when they started the School of Nursing on the Henry Ford Hospital campus. Henry Ford Health nurses embrace our core values, and tonight I want to share with what our nurses across the system have to say about the spirit of nursing here at Henry Ford Health. So we've got a little video to show.
The nurse is confident, the nurse is strong, and the nurse is compassionate. Compassionate, caring, wonderful. The nurse is brave, the nurse is encouraging, and the nurse is nurturing. The nurse is someone who's compassionate, resilient, and dedicated.
I had a couple of experiences early in my life where family members spent a lot of time in the hospital, and seeing how they were treated and the difference that different healthcare providers made really had a big impact on me.
We just have so much to glean from the wisdom of older adults. I just love caring for that population.
My wife was a nurse. My mother was also a nurse, but my wife really influenced me into going into the profession.
Because my grandmother was a nurse. So she was the inspiration behind the decision. My father is a physician. My mom is a nurse. I have never, ever once questioned it. When I started going with my grandpa to his cancer treatments, and I saw how the nurses cared for him and how they helped him during their care, during like his treatments. And so I really wanted to give that back to someone else. Have an organization that values principles like integrity, respect, innovation. You know, those are all values or principles that I value. I like Henry Ford because it is dedicated and committed to servicing the Detroit community and surrounding areas. I feel that I see such a wide variety of patients. I'm able to care for so many people.
I love the connect that I have with the team. The people that I was surrounded by were all very caring people. They were very dedicated to their jobs, and I just knew that that was going to be the place for me.
I truly feel that each and every day I get to experience something different, or I get to meet new people. I think as nurses, we're educated and trained to be adaptable and innovative. So I think that makes us stand out or rise to the occasion.
You are part of this team, and they want you to be here, and they want you to work here.
Working with, but for each other.
Team that I work with has is just, I've never seen anything like it.
Nursing care is being delivered in so many different innovative ways, especially now with telemedicine. Nurses are really have more opportunities in leadership roles.
You see advancements, you see new tools that we can use, you see new ways of doing stuff, and all those little things come to make things seem to go a lot smoother. The fact that Henry Ford wants to try those new technologies and be proactive and forward thinking, I think is really cool. Being able to provide care for those patients in their home, being able to educate their family, and the most rewarding part is to see those patients get better. Being in a hospital is a rough time for anybody, so if I can make them smile or laugh just by the smallest thing, then I know I've done my job.
Sometimes they just need someone just to talk to, and for me to be that person, it is rewarding in of itself.
It's somebody else's life that we get to make an impact on, just so special that we're just a part of big moments of people's lives. I can always figure out at one point in my day, you know what, I did that and that person really appreciated that and it did good for them. I have found that Henry Ford nurses are very passionate about doing the right thing at the right time for the right reason.
This is not a job to me. This is my life. I'm a wife, I'm a mom, and I'm a nurse.
Every last picture, card that I've received from my patients, I still have them. The one thing that always sticks in my head is something that a mentor of mine once said, is that as nurses, we have the privilege of serving people in what may be the worst day of their life.
My name is Penny Ellis Ducky, and I am a Henry Ford nurse.
My name is Joe Anderson.
Rachel Chamala, Teresa Jeffers, Aaron Segan, Taylor Long, Majida Muhammad, Channing Bryce.
I am Eric Wallace, and I am a very proud Henry Ford nurse.
So not the first time that I've seen that, but it still gives me chills every time I see our folks talk about their passion and their sense of purpose for being here. So wow, I'm so proud of the folks that volunteered to be part of that. Tonight, you know, we're here to celebrate Henry Ford health nurses whose amazing dedication makes them stand out, not only their patients, but also the team members that they work with every day. This prestigious award that we're here to celebrate tonight was named in the memory of Clara Ford, an advocate for the Henry Ford Hospital School of Nursing. The School of Nursing was founded in 1925. It included a 300-room nurses' home named for Clara Ford to house all the nursing students. The diploma school offered training in basic sciences and nursing practice, graduating more than 5,000 students and ensuring in its ensuing 71 years of operation. The school is known for its high standards and excellence in education and practice. The Ford grads were easily recognized by their skillful care of patients and their unique caps. With the history of Henry Ford Nursing as its foundation, the Clara Ford Awards for Nursing Excellence are bestowed annually upon 6 nurses who are nominated by their colleagues. This year, we are thrilled that more than 130 nurses were nominated. I would like to applaud, hopefully you'll join me, in recognizing all of the 2022 nominees at this time. Each of these nominees was nominated in one of 4 areas: safest care and best outcomes, exceptional experience, affordable, efficient care, and compassionate, committed people. We had a selection committee that was representative of our nurse executives from across the health system. The nominations were blinded without a name or operating unit to be indicated, ensuring that our winners were selected based solely on the merit of the nomination. So I'd really like to thank our selection committee, most of who are here, Kathy Bonikowski, Gwen Nam, Wendy Kim, Mary Kravetsky, Mike Markle, Kim Meeker, Stephanie Roberts-Newman, Donna Summers, and Kat Wagner. Each of the honorees we'll receive this evening was created specially for Henry Ford Nursing, and there's a shadow box that includes a blue ribbon, a bronze medallion with the image of Clara Ford and one of the first nursing classes, a pin created for this award, which was designed based on the emblem on our Clara Ford pavilion, and a description of the award displaying the name of each winner. This evening, we will share stories of each of the 6 awardees with you. I am proud to stand here this evening representing the more than 6,000 nurses that work throughout our health system. In addition, we sincerely thank the Henry Ford Health Team members who individually and collectively support the advancement of nursing and nursing practice throughout our system. Again, thank you for joining us this evening, and I hope you'll find the 6 stories that we're going to share tonight inspiring. It's now my pleasure to invite Wright Lasseter, President and Chief Executive Officer of Henry Ford Health, to the podium. Wright?
Afternoon, everyone, or good, I guess it's closer to evening now. I want to join Eric in saying thank you to, first, Eric, to yourself for your leadership as our System Chief Nurse Exec. Secondly, to our nursing leaders, to my right here for all the work you do in supporting our organization's leaders, and then obviously to everyone who organized the event and to our awardees. I'm glad Eric mentioned that there were more than 130 nominees because I was in the process of counting so that I could say, you know, how many people are nominated. So you saved me a little bit of effort, Eric, but I want to thank you very much for, and I want to acknowledge all of those who were nominated. As I look at the number of nominees, I find it fascinating and very consistent with the values of this organization and with who gets attracted to Henry Ford, that the most nominees were in the compassion area. I think it just speaks volumes to what people who take up the call for nursing, what's important to them. Some of you know that, as you heard stories about folks and their ties to nursing, so my mother was a nurse, and she worked many years, a bit over 30 years, both in hospitals, teaching other nurses in the School of Nursing, and then she finished her career in public schools with nursing in the public school environment in Dallas, Texas, where she tried to ensure that the kids coming through that system had the health needs, that their health needs were met. And so nurses have always had a really special place in my heart. And so I want to just thank you all. As I look at our awardees, just really excited for the work that you do on behalf of the organization. As I listen to the stories and what resonates with nurses here, it is a thing that makes our organization amazing. It is a longstanding sense of values. It is our compassion for doing the right thing and providing the best care possible. And it is a connection that our organization has to the community that we serve. And so all those things are really quite exciting and bring us together in a really amazing way. Eric acknowledged that we have special guests in the audience, and these 2 individuals never like to get a lot of attention or take a lot of credit. But what I've found in the nearly 8 years that I've been here is that they are always being recognized for the quiet things they do. And even though they don't like a lot of attention or a lot of recognition, they get a lot of it because they do a lot of amazing things in the community. And so, you know, having Clara Ford's great-grandson, Edsel, and hopefully I won't pay for this later, and his better half, Cynthia, in the room, sort of committed to supporting nursing the way they do, and frankly, so committed to the success and support of our organization is really special. And so I know that Eric called you out earlier, and they never like to get a ton of recognition, but you know they're getting it because they're really special human beings, and they are committed. They are committed to supporting nursing in our organization, and they commit their time. You know, there are a lot of individuals who share their treasure with organizations that they care about. Not everyone shares their time and their passion the way that this couple does. And so we are immeasurably grateful for your support and for what you continue to do on behalf of nurses. And I know they feel the spirit that you share. And so really excited about that. You know, I would just lastly just say this, that, you know, our organization, with all the things that we try to do to set ourselves apart and to demonstrate our true commitment to helping all that we encounter live their best lives from a health perspective. We just tell you that this award means an awful lot to those who are close to nursing and those who aren't so close to nursing, like myself. I've never practiced nursing. I'm not a clinician, but obviously we could not be as successful as we are for the century plus years that we have existed without the dedication, commitment, and loyalty of our nursing corps, and without the amazing leaders that we have assembled in front and on the sides who are doing the critical work to support your efforts. And so on behalf of all of them, on behalf of our board of directors, and frankly, more broadly on behalf of the communities that we serve, I want to say thank you to all of our leadees and to all of our leaders for the work that you do on behalf of the organization. And so I extend my sincere congratulations to you, and I look forward to not standing in the way of your recognition a second further. And so with that, I will, I think we're going to have a video message from Bob Ryan, who couldn't be with us tonight. And so Eric, I'll turn it back over to you to continue the program. Thank you very much.
So as Wright mentioned, I think we have a little video message from Bob.
Thank you, Eric. Good evening, everyone. I want to personally congratulate all of the Clara Ford Nursing Award winners. As I read about each of your contributions, I was truly inspired by just your extraordinary professionalism, your leadership, your can-do-it attitude, and just representing everything the best part of Henry Ford Health. In fact, all nurses are just a very, very special class of people. I know personally because I've been married to a nurse for over 40 years. And I will tell you that the last 2 years have shown that the word hero truly belongs after the name of each nurse. Enjoy this very special evening and know that you really inspire us and you really motivate us to continue to make sure that this health system is meeting all the needs of the communities that we serve by first and foremost having the absolute best in nursing that you could experience anywhere. Each of you represent that. Enjoy your evening.
So thanks to Bob for filming the video for us. Also, we have this evening Dr. Clara, who's also not able to join us tonight, but he also filmed a little video message for all of you.
Thank you, Eric. I would like to congratulate our extraordinary nurses who are being recognized today by the Clara Ford Awards for Nursing Excellence and for your embodiment of compassion, caring, innovation, and leadership. I would also like to recognize all our nurses across the system for the outstanding performance that you have shown in the past 25 months since we have admitted our first COVID patients. You've been amazing in tending the sick, caring for the ailing, comforting the suffering, and embracing and hugging the grieving and the anxious, all with love, compassion, and dedication. You have adapted to workforce shortage and made sure that our patients are well taken care of. And unfortunately, in certain situations, you had to deal, like many of our frontline staff, to some unruly and violent, unacceptable behavior from few patients and their families. You've done that with courage, dedication, grace, and commitment. To all our nurses, a heartfelt gratitude for all what you have done and continue to do. For our awardees, kudos for a job well done and for achievements that are driven toward a purpose and by high values. You are an inspiration to all of us. Thank you. I'll turn it back to Eric now.
Well, thank you, Dr. Mankara, as well. And so we have reached the point where we're ready. Let's do this thing. All right, so I'm going to invite Wright and Cynthia and Edsel to come back up to the stage. And I think we've got some chairs for you because I get the opportunity to read some of these amazing stories as we start through our 2022 Clara Ford Award winners. And so we're going to begin the celebration by talking about the winner of affordable, efficient care that provides value, Ms. Christine Adams from Henry Ford Hospital. Bear with me. These are amazing stories, but you got to bear with me reading them. So, Christine is a clinical nurse specialist in the neonatal intensive care unit at Henry Ford Hospital. The NICU is the only one in our organization, and the unique care that is provided requires the nurses to have a very specialized skill set. Working with staff and leaders, Christine identified an opportunity to both enhance and streamline the orientation for new NICU nurses. All nurses are required to attend system nursing orientation. While this orientation is extremely important, the content covered does not always apply to the neonate, as is more often geared toward adult patients. Christine took the time to compile and review all the orientation materials currently used in the NICU. She identified where topics discussed in system nursing orientation are again covered, perhaps with a focus on the neonate and during the NICU orientation process. Changes made to the orientation were done so that with feedback from the NICU preceptors and nurses who had recently completed orientation. She worked to find solutions to address the very important aspects of system orientation, but tailored to the needs of the NICU nurse. Areas that were duplicated or addressed in the standard NICU orientation were eliminated. Through this work, the time NICU nurse had to spend in system orientation was decreased by 44%. Feedback from recently hired nurses and preceptors has been very positive. Christine was instrumental in soliciting feedback from staff and preceptors and was able to use her extensive NICU orientation knowledge to identify areas of redundancy and to develop educational content specifically geared to the NICU population the first week of orientation. Her work will result in a 1 to 2 decrease in orientation days for progressive care nursery, which will also have a positive impact on the budget. Congratulations, Christine. See, once again, we proved the adaptability of nurses and the ability to figure things out on the fly. Second award this evening is in the category of safest care and best outcomes. So let's talk about Hannah Musgrove, RN, Henry Ford Hospital, our safest care and best outcomes awardee. Hannah is also a clinical nurse specialist in the surgical intensive care unit at Henry Ford Hospital. Hannah demonstrates an extraordinary investment in the safety of our patients. She also takes it upon herself to provide exceptional support and service to our clinical and quality teams. She helped us to form a team to work on decreasing hospital-acquired infections in the surgical intensive care unit. She contributed to the success of the SICU in reducing hospital-acquired infections, working to decrease central line-associated bloodstream infections, methicillin-resistant Staphylococcus aureus, and Clostridium difficile rates. Hannah was selected for a poster presentation for these projects at the 2022 Association of Clinical Nurse Specialists annual conference. Hannah was also involved with research regarding second victims. Second victims are healthcare providers who are involved in adverse patient events. Their emotional duress can be long-lasting, resulting in job changes, leaving the profession, alcohol or drug abuse, or suicide. A survey was sent out to 1,100 RNs. A significant relationship was found between years of experience at the hospital and identification as a second victim. Different from previous studies, Hannah's team found that second victims in this study did not feel blamed by their supervisors. While the research was conducted prior to the COVID-19 onset, the study directly impacted staff support during the pandemic. Hannah was one of the driving forces in this research and took accountability for the spread of this knowledge throughout the organization and now on a nationwide, worldwide stage. She presented on this topic at the National Magnet Conference and was able to share lessons learned there to an international nursing audience, usually about 10,000 nurses, so just a few folks. She also participated in authoring an article regarding the study with other team members, which was accepted for publication by the Journal of Nursing Care Quality. The article, Perceptions of Nurses Who Are Second Victims in a Hospital Setting, was recently published in the April to June 2022 edition. So congratulations, Hannah. All right, next up, exceptional experience. This category actually has our next two award winners. And the first one goes to Lydia Ilievsky. See, close. Lydia is a registered nurse on our 4300 unit at the Macomb Hospital. Lydia consistently demonstrates superb, loving, and caring behaviors when interacting with her patients. She builds strong and trusting reports while providing exemplary care. No matter the situation the team finds themselves in, she always maintains a positive, can-do attitude and role models strong work. This is evident in Lydia's efforts to encourage her bariatric surgery patients to walk around the unit as part of their recovery. Oftentimes, patients may find this challenging to do so as they may be experiencing pain and some nausea. So Lydia goes above and beyond to encourage her patients by asking what their favorite music is and has them listen and dance to the music playing on their cell phone while they walk around the halls. Patients love this, and it helps to motivate them, but also makes their hospital stay fun. She's always looking for ways to make the patient's hospital stay more enjoyable. There was a patient with autism on the unit for a few months, and Lydia was always looking for ways to make his stay more enjoyable. While he was hospitalized, she acted like a mother to him, bringing foods he enjoys and even taking home his clothes to wash them. She learned he loved McDonald's, so Lydia would take her break to go to McDonald's and get him some. This individualized and loving care Lydia provides is what nursing is all about. Congratulations, Lydia. We're expecting you to dance up here.
Where's your phones?
Let's work on it.
I'll do it. Thank you.
All right, so I told you we got two. So our second award goes to Adam Sines, RN Henry Ford Jackson, for exceptional experience. Adam is a clinical unit leader on the 5th floor at Henry Ford Jackson Hospital. It's not uncommon for Adam to pitch in and help when he's needed. Several months ago, there was a patient who suffered a cardiac arrest, and it was a very difficult code. Adam jumped right in to help the team. Unfortunately, despite the team's efforts, the patient did pass away. When Adam learned that the patient was of Jewish faith and there were certain measures that needed to be followed to honor his faith, he took it upon himself to make several calls, including to a local rabbi, which wasn't an easy thing to do since this happened in the middle of the night shift. With the help of another team member, Adam was able to determine how the body should be honored and was able to carry that out. It was Adam's willingness to take the time to honor this patient, even in death, that showed great compassion and commitment as a nurse. Even the rabbi reached out the next day to let senior leadership know what Adam had done, as he was so impressed by his actions. Congratulations, Adam. So next we're going to transition to the awards for compassionate, committed people. Again, we have two awardees in this category. And the first one is our award is for Compassionate, Committed People Award is for Rita Alcaraz from Henry Ford Jackson. Rita is a nurse on the 16 Medical Universal Bed unit at Henry Ford Jackson Hospital. As one of our ICU RNs, she routinely participates in interdisciplinary rounds, but she takes it a step further when making sure the patient's family is involved. Well, this means personally calling family members to ensure that they're on the same page, or taking in an iPad to the patient's room so they can see their loved ones. She will make sure that to engage the family. Her nominator shared one specific story of her collaborating with providers, where a patient was on an epinephrine drip that was going dry relatively quickly. She saw how often the nurse was going in to change out the bag, and so she collaborated with the primary nurse, the intensivist, and the pharmacist to have the bag of epinephrine delivered that was double the strength so the rate could be reduced, and help the nurse to avoid changing the bag every 30 minutes. Not only does she communicate with her patients, but she also goes a step further to ensure all around her are doing the same. Her nominator goes on to say she is hands down one of the most genuinely compassionate people I have met. She cares wholeheartedly for every one of her patients. One moment that stands out to me is while we were trading off a COVID patient that had no visitors or loved ones come to see her because they were fearful of catching the virus. That was one of the hardest things for the team, to see people struggle alone. She mentioned to me that studies have shown how much humans need physical touch and to help the mental health state. But all of these COVID patients haven't had a truly special physical touch. It's been medically needed touch from the staff. She went into her patient's room to simply hold her hand. And then she took it a step further and inflated a glove as a hand to keep on her intubated and sedated patient's hand to help her feel like someone was holding her hand. You could see that compassion every time one of her patients passed without loved ones in the room. She would gown up and go into the patient's room and simply hold their hands so they would not die alone. As she stated before, she has more compassion for her patients than anyone I've met thus far. Rita advocates for every patient as if they were her loved one. She was caring for a developmentally delayed patient who was having a really hard time being out of his routine. She helped advocate for him by calling his guardian to try to find a way to calm him. The patient's guardian stated that he liked stuffed animals and a certain TV show. She went on a mission to find a stuffed animal for this patient. The next day, I walked into the patient's room to see him snuggling with a stuffed teddy bear with a huge smile on his face. She went above and beyond to help this gentleman get what he needed to be comfortable. She ensures the best care possible is always given. During rounds, she will point out any issues that need to be addressed, and she is quick to help anyone in need. Thank you for all that you do, Rita. Second compassionate care awardee is Susan Walls from Home Care. Susan is a home care nurse in community care services. According to the nominator, Susan was born to be a nurse. She has wonderful technical skills, but as good as her skill set is, application of them while seamlessly addressing emotional, psychological, and spiritual needs, along with the physical, sets Susan apart. Her emotional intelligence is astonishing, making her able to quickly relate with people from all walks of life. This translates to deeper understanding of what her patients' goals are so she can most effectively meet their needs. Susan often works with very challenging neighbors and neighborhoods, and with our most critically ill patients with little or no social support. I'd like to share a couple of examples of the care Susan provides. One of Susan's patients found himself facing the loss of his foot. All of a sudden, I had 3 toes amputated and I was very scared, he said. When Susan opened his case, he already had lost 2 middle toes and the entire top of his foot, leaving copious amounts of drainage in the wake of these procedures. His only supplies at home were a small box of 4x4s and some black foam for a wound vac. His goal was to keep his foot, and Susan was determined to make that happen. She purchased the ordered wound cleanser and gauze herself to get it started and returned to his home to clean his wound and dress it properly. Mr. H needed a nurse to change his wound vac every day due to his fragile condition. Susan did this mostly herself, often even working her days off to minimize the risk of infection and keep the technique consistent. The wound vac was on my foot 24/7, he said. I got impatient with it. She helped me cope with it. She talked me through it. Their shared tenacity paid off. In 3 months, the wound was healed. Mr. H not only didn't lose his foot, he regained his independence. At the end of his home care service, he was able to walk to his clinic appointments. As self-reliant as Susan is, she is also quite capable of enlisting and coordinating assistance of others when a patient has a need. When Susan met Fred, he was living with friends, occupying the unfinished basement in their Southwest Detroit home. Though he had no complaints about his accommodations, Susan felt the situation needed to be improved to get the best possible outcome while treating his cancer. Susan contacted Game on Cancer and received $750 to help address his needs. Susan coordinated the best use of the funds available, procuring Fred a bed, mattress, chair, and a small table. This enabled Fred not only to keep his supplies clean and get some much-needed rest, but also help him regain some basic dignity that was lost because of his situation. What's more remarkable is she was able to get all of this done and return $250 back to the Game on Cancer so other patients in need would have the funding available. Thank you, Susan, for your commitment to caring the whole patient. Before, well, I'm gonna go a little off script here, right? So I told you that we had 6 awardees. We actually have 7. So if you'll indulge me for just a moment. As some of you know, I assumed the role of System Chief Nursing Officer about 6 months ago. I had the privilege of following Barbara Rossman, who very capably steered the ship of the health system as Health System Chief Nursing Officer for a couple of years. Under her leadership, a system nursing strategic plan was developed and implemented, and she led nursing through standardized practice across the system. Incredibly, she did this while supporting both our Macomb Hospital and the system nursing team through our pandemic. Barbara has left a great path for me to follow in this role. So I think it's only fitting that we would recognize Barbara as not only the President and Chief Executive Officer at Henry Ford Macomb, but for her incredible service as System Chief Nursing Officer. So Barbara, would you mind joining me on the stage? All right. So before we end, if it's okay, I'd like to invite Cynthia and Edsel, if either one of you would want to come up and say a few words as our honored guests here this evening.
You. My husband has nominated me. I wouldn't really say a few things, but clearly we came somewhat unprepared, knowing full well that being in this company, which is extraordinary to be in the company of caregivers. I mean, very few of us actually get this opportunity. So first of all, it is truly a privilege and quite an honor to be among you today. So thank you for inviting us to be a part of it. It really matters to us. And I knew before we got here that there would be something that I heard or learned today that would be inspiring. And it didn't take long watching the nurses and listening to their comments. It just struck me that not one of them referred to themselves. There was nothing about me or I, or it was all about giving care, showing compassion, giving service, being part of a team. I would add enormously accomplished, truly wonderful human beings. And I think, well, I know that Edsel and I realized this probably most importantly at the beginning of the pandemic, when every single one of you gave above and beyond what anybody else in the community was giving. And frankly, we know that you're just human beings like the rest of us. You're caregivers. You stand above and beyond us as far as helping your fellow man. But you've got husbands and wives and children and parents, and we wanted to honor your selflessness in the best way we knew how. And we hope that what we've done only adds value to your lives and the lives of your family, because there's not one of you who doesn't face what the rest of us and what the people you serve every day go through. You just do it, and then you go home and deal with the lives the rest of us are dealing with. So thank you very much. I mean it sincerely. It is truly an honor to be among you and to be able to support you in the way that we have identified. Thank you all very much.
I really don't like following my wife. She's a significantly better speaker than I am. But I was sitting there listening to all the honorees and all of your accomplishments and the team here, the leadership team, thinking about if Clara walked in tonight. Sorry, what would she say? What would Clara say to you? And I think she would say exactly what Cynthia said. Thank you. You're a wonderful group of people. You're dedicated. You care so much about Henry Ford Hospital. You care about your patients. And so we, as members of the family, want you to know how much we appreciate everything you do. So God bless. Thanks very much.
It's hard to follow that up. You know, I hope that as we think about, you know, this evening, we really do take away from this just the amazing work that happens each and every day. These stories, while they are amazing examples of the individuals who are here and their commitment, their passion, I think our reality is these kinds of stories happen every day in our organization, and we don't always capture them. Because people just do it. It's just their heart of service, and we are so grateful for the spirit of nursing within Henry Ford Health. So I hope that you all, like me, walk out of here tonight in awe of the work that our nurses do. And I think the best thing that we can do at this point is to once again acknowledge, recognize, applaud the incredible spirit of Henry Ford Nursing. And again, I just would like to thank all of you for being here. I think it shows that even though we're not back to where we want to be with these kinds of events and having the room full, the commitment of our leadership team to recognize and support our nursing team shows through over and over and again. And so I really thank you all for being here this evening. And with that, that concludes our program. Thank you.